Hey, this is pretty interesting from a Joe Rogan episode earlier this week. Now, I know that a lot of people want to talk about Joe Rogan saying he'd vote for Trump over Biden. That's a different story. That's not today's topic. I hope to be able to talk to Joe personally about the Trump Biden thing soon. But for today, I want to play some clips for you of Republican Congressman Dan Crenshaw on Joe Rogan's program earlier this week. And in the context of coronavirus, they got to talking about healthcare, and Dan Crenshaw rolled out just about every bad argument about healthcare. And what I really like about this is how Joe Rogan ended up kind of de facto destroying the arguments that Dan Crenshaw was making, but in a way that was just completely genuine. It wasn't calculated with talking points. And what I mean by that is Joe Rogan is more of a political hobbyist than a political analyst. And he even said recently, when I say I think I'd vote Trump over Biden, I don't know what I'm talking about. And he actually said, go, listen to people. He actually listed the David Pakman show. Go listen to people who really are doing this full time. He doesn't consider himself a political expert. I dub it more of a political hobbyist. And Joe has said many times, politics is not his main thing. He's interested in it. He has opinions. He talks to people, but he's not a politics guy. So what's interesting to me about the clips that I'm going to play for you is that Dan Crenshaw is making bad argument after bad argument, arguments that have a lot of history in different political circles as being the types of talking points you want to use. And Joe dismantles them not by trotting out his own crafted talking points, but just by kind of reacting in real time with common sense to the nonsense that Dan Crenshaw was saying. So let's get right into it. I think you'll find this interesting. First, here is Dan Crenshaw trotting out a popular argument from libertarians, including people like Rand Paul, which says Medicare for all or single payer reduces freedom and it sort of enslaves doctors. They argue we're not free with Medicare for all. And Joe Rogan makes pretty quick work of it. And you'll see Dan Crenshaw become visibly confused and sort of start jumping around with non sequiturs, trying to retort, but failing.
When we talk about Medicare for all, it tries to move past these essential foundations, whether of a free society that we have to adhere to. And because the other thing I push back on a little bit is the healthcare as a right statement. And I push back against that because when you're calling something a right, what you're effectively saying is that somebody else has a obligation to serve you. And it's hard to call something a right when that right requires the service of somebody else.
Don't we already do that?
Nitpicky.
Don't we already do that with the firemen? Don't we do that with the police department? Don't we do that with public schools?
Not exactly. No, I mean we have public services that I would distinguish those public services from something like a direct point of care, and I would distinguish them to an enormous extent. And here's why: you can add a few 100,000 more people to the nation's population, and it doesn't change the mission of the military, right? Like it doesn't take anything away from them. But because of this sort of non-rival, this is like an economics term, but this sort of non-rival attribute of these things, it is different, right? Because there's only a select number of doctors. And we've already said that once you put price controls in, there's going to be less doctors because doctors will be paid less. They'll get burned out more. Then hospitals will be able to, I actually never finished that point.
So Dan tries to slip in, this is an economic term, implying, a lot of people don't know this term. But this is an old libertarian argument. That's a really bad argument. So here's the deal. Single payer doesn't make doctors slaves and it doesn't take away freedom. In fact, we already have the Emergency Medical Treatment and Active Labor Act, which mandates that hospitals must provide stabilizing emergency treatment to patients in a dire emergency situation or delivery services to a woman who is in active labor, period. No matter whether they can pay or not, no matter whether they have insurance. If you're an ER doctor and someone comes in with an emergency, you must give them stabilizing treatment. This has been around 34 years, since 1986. Back then, you had some people saying you're enslaving doctors, but you're not. And it's a bad argument. Consider lawyers. Everyone has a right to an attorney, even if you can't afford one. You have a right to an attorney. Are attorneys slaves? Are attorneys enslaved by that? No. Now, does any one lawyer have to take a certain case? No, typically not. Does any one doctor have to treat a specific patient under single payer? No more than the general responsibility to the Hippocratic Oath and to provide emergency stabilizing treatment, which dates back 34 years. Bad argument. Let's continue.
The reason price controls reduce supply and the reason we see supply reductions in other countries is because, well, hospitals don't get the same amount of money. They're not going to invest in that extra ICU bed. They're not going to buy those extra ventilators. They're not going to hire those other doctors. A doctor doesn't want to be a doctor because they don't make the amount of money that they thought they would make. They're doing extra work because there's more people who now have access to them, but there's less of them. So wait lines are huge, and they're seeing multiple more patients a day. Doctor burnout increases quite a bit. That's the quick answer as to why that happens. But does that kind of answer your question?
Now, here I really need you to understand. This is a Gish Gallop. Dan Crenshaw is throwing about 4 to 5 different arguments at Joe Rogan. None of them make sense. None of them are actually arguments against single payer. And now he's moved beyond single payer and is starting to talk about reimbursement rates, doctor compensation. That's one issue. Many countries have successful systems, but they've got to figure out doctor compensation. That's just one issue. Then Dan Crenshaw throws single payer will increase demand and every hospital is going to be full. That's an old, tired argument. When you give everyone health care, it doesn't increase demand in total. It shifts demand from people using emergency rooms and waiting until things are more serious to people going and getting checked out earlier, going to their pre-CP instead of the ER. And that actually can, in many ways, lighten the load on emergency rooms and emergency care and reduces the serious conditions because people get checked out earlier. So Dan Crenshaw here makes so many different arguments in 30 seconds that it's hard to keep up. Now let's skip forward to Joe reacting to this.
This is getting really
that does
deep on this.
Yeah, the human right issue. We kind of moved around with that. The idea that it's different than the fire department or the police department. Or
well, it's not a right either. Actually, the fire department's not necessarily a right as we would.
But it's a public service that's provided to everyone.
Yeah, it is. But understand. So let's call it a public service then, and let's call doctor healthcare a public service as well. If we were to do Medicare for all.
But wouldn't the result be the same if it's provided for everyone?
Not from a practical standpoint, just because it's much easier. Again, you could add 100,000 people more to your city and the fire department would have marginally more work to do.
Dan Crenshaw says, not from a practical standpoint, but actually, yes, Joe is right. It would be the same thing from a practical standpoint. It would be different from an ideological standpoint where, Dan Crenshaw's ideology makes healthcare different than being a firefighter. But in practical terms, it is basically the same thing as Joe Rogan points out. Let's skip ahead a little now. And this is just bad from Dan Crenshaw. And Dan does something slippery. Dan starts talking about socialism as a system more broadly rather than just talking about healthcare. Joe's talking about healthcare. And then this is just amazing. Remember how in the clip I played for you, Joe Rogan was saying healthcare for everyone as a public service or a right or whatever you call it. It's like firefighting, it's like police or public education or whatever. And back 5 minutes earlier, Dan Crenshaw argued, no, healthcare is different. Now in this clip, only a few minutes have gone by, and Crenshaw says, no, Medicare for all isn't socialism, it's a public good. That's right, Dan. That's what Joe said 5 or 6 minutes earlier when you said, no, it's different. Take a look.
Right, but we're talking about you're talking about socialism overall, not just just involving medicine. You're talking about socialism in general, and I'm saying, isn't the fire department an example of socialism that works?
Well, it's definitely not an example of socialism. I think it's an example of a public good, the way the military is an example of a public good, the way the highways are examples of public goods, the way parks are examples of public goods. Right, but
they're funded by the people. It's funded by people overall, and it doesn't cost people money to use them, and the people have these as a basic part of our society and our civilization.
Dan Crenshaw is just a human pretzel here. He's completely wound up into knots. When Joe says it's a public good like these others, Crenshaw says, no, it's different. 5 minutes later, when Rogan says, aren't we socializing an element of the economy and an element of society that works fine to socialize? Crenshaw says, no, it's not socialism. It's merely a public good. Well, okay, why didn't you agree with Joe when he said that 5 minutes earlier? Here's Crenshaw's last reaction. And Crenshaw, he basically white flags and he plays these pedantic semantic games and says in the end, these are really just semantic issues.
No, I understand that, and I have no problem with that. I just would not call them socialists.
Well, what would you call the fire department? How does it get funded?
It's a public good.
How does it get funded?
It's a public good. It's funded by the public,
right?
And it's not relying on it's not relying on the tenets of socialism to function. And now we're kind of having a discussion of definitions, and this is an important discussion to have because oftentimes even Democrats aren't really talking about socialism.
Well, even Bernie Sanders doesn't call it socialism. He's talking about democratic socialism, and he makes some very clear distinctions between the two of them, which I think you could apply to things like the fire department or the police department.
Yeah, there's a lot in that.
So there's a lot there, and I'm not going to subject you to more of this, but I like this for a few different reasons. Number one, they try to stake ideological claims when they can. But when Joe Rogan breaks down those claims with simple questions, they retreat to semantic games and gish galloping, which is just throwing out so many different assertions that it becomes very difficult to keep track of them and actually refute them one by one. That's a sign that the facts aren't on your side. But number two, you all know I've been critical of some elements of Medicare for All plans. There are issues around cost estimates and other issues with a lot of these plans. I would actually love it if the left and right could simply agree on what we know, which is Medicare for All will increase access and Medicare for All can maintain or increase quality. The question is, at what cost will we be able to maintain quality and increase access to 100%? The coronavirus stimulus has proven when we want to, we can find 2 trillion. We can find 6 trillion. We can find 10 trillion if we want to. The money is there if we decide we are going to do it. I would much rather be able to move past these childish arguments that Dan Crenshaw is laying out, which Joe Rogan exposes as really very bad arguments. Let's get our hands dirty and do the nitty gritty work of figuring out how this can all work, because it can work. It's a question of at what cost and how to best optimize it. Let me tell you real quick about one of our sponsors, Cuts Clothing. They offer super quality men's t-shirts, and they're giving you 15% off when you go to davidpakman.com/cuts. That's CUTS. Because solid color t-shirts are a really important staple in pretty much every guy's wardrobe. I think it's really important not to overlook the value of having t-shirts you love wearing. T-shirts from Cuts Clothing have been a game changer for me. And as a company, all they deal with are men's solid color t-shirts. So they actually put a ton of thought into the comfort, the style, the durability of the t-shirts they make. They fit perfectly. They're not scratchy. They don't shrink. They don't fade. They don't stretch out over time like so many other t-shirts. They're really the most comfortable t-shirts I've owned, and they look great. This right here that I'm wearing on YouTube is the split hem crew neck t-shirt. Very soft, fits me perfectly. It's the ideal length. Go take a look at what they offer, and once you have it, you are really going to see and feel the difference. Their slogan is, "It's the only shirt worth wearing." You will see why, and you'll get 15% off when you do it by going to davidpakman.com/cuts. That's davidpakman.com/CUTS.